Afternoon, good evening, all of you wonderful people who have joined with us both in our Zoom room and on Facebook Live on this wonderful Wednesday, this worship on Wednesday, this opportunity that the Lord has given to us to gather together. And certainly we're grateful for this day and grateful for you, and for you for being with us on this worship on Wednesday. And it's a special day as we have some special guests who will be with us on this evening. We're going to share from the field of their expertise in a way that I believe will be beneficial for us, for our knowledge, for our community, that we might learn something tonight as it pertains to COVID-19, the vaccines that are available to us, and how we might improve the information in such a way that people would want to run to be vaccinated, that we might do good for the greater good of the community and for ourselves and our families. So we thank you for being with us tonight. I want to pray, and once I pray, I'm going to turn it over to these incredible doctors, these incredible medical doctors who are going to help us tonight in sharing some incredible information with us. So I see you guys joining in on Facebook. Good to see you. Those of you who are coming into the Zoom room, we thank God for all of you. Would you bow your heads and your hearts with me? Father, thank you so much for this wonderful opportunity that you give us to be the people of God gathered. And thank you, Lord, even more that our commitment to you extends to our commitment to one another, that we might love one another. And Lord, one of the ways that we demonstrate this one anothering in this season of pandemic, is that we're able to access the technology and the advancement of medical science that you've made available to us through these incredible men and women. And we thank you today for these women who are going to share today from their field of expertise. And I pray, Lord, that we would be receptive audiences, that we would be good soil for what they will share for us today. That's our prayer. In Jesus' name we pray. Amen. I'm really excited and humbled. I would spend a lot of time, and I will share the bios of these incredible doctors on our Facebook page. So those of you who want to go in and read more about these incredible individuals today, I will share that. But I am going to turn our program over to these incredible doctors and practitioners who have been on the front lines, who are going to share some great information with us today. So I'm going to introduce Dr. Ayers to you at this point, and I'm going to remove the pen from my screen. So Dr. Ayers, the floor is yours. Again, those of you who are on Zoom, make sure you're on mute if you're not speaking so that our audience can hear clearly. Dr. Ayers.
Thank you so much. And I really want to thank all of you for inviting us. Really, this is a sponsored program by the New Jersey Black Women Physicians and Associations. Dr. Brugge has brought us all together. She'll be speaking to you a little bit later. And we also have our colleague, Dr. Gway, from RMA, who will be also speaking tonight. I just to give you a little bit background for me, that I'm an OBGYN, and that's my specialty. I also work at Rutgers University and I'm part of the Department of OBGYN in New Brunswick. But the real reason I'm here is I'm also the chairwoman for International Healthcare Volunteers, which is a nonprofit organization that provides care to underserved women nationally and globally. So on behalf of IHCV, I want to say thank you very much for inviting us. Dr. Gway is going to be helping with my slides, so I apologize. I'm going to say next slide. And we wanted to talk about exactly these unprecedented times of 2020 with COVID. Next slide. This has really impacted all of us. And it's impacted us in so many different ways. And so we were asked to come and answer some of your questions regarding actually what is COVID, as well as its impact on our community, and regarding what are some of the vaccines that are presently available to individuals in order to prevent this illness. A lot of people never knew what COVID-19 was. It's really an infection that's associated with a virus, a SARS virus. We have seen this virus multiple times in the past, and so this is not new. But this is a specific type that we haven't seen until recently. The range is multiple ranges of illnesses, from mild to severe illness to even death. Some of the mild symptoms are headaches, fever and chills, to the severe illnesses where people have shortness of breath, inability to breathe, severe abdominal pain, to even we know so well that even many individuals here in the United States have died, and even here in New Jersey. We don't know, however, how this virus will impact you or me. So it might just impact me by having just a common cold-like symptoms. It might impact someone else that I live with severe symptoms. So that's the reason why it's really important that we discuss this, because some people who have had COVID-19 infections don't have severe illnesses, but others do. And the severity is very severe at times if they need to go on respirators, or even if they are hospitalized for prolonged periods of time, or even if they unfortunately die. We know that there are some risk factors for this virus, and those risk factors we know are basically for older individuals, usually individuals who are greater than 65. The other risk factors are for individuals with medical conditions. And some people say, what are those medical conditions which increase my risk for me to have more severe illness? Well, they are hypertension, diabetes, being overweight, having other immune type disorders such as lupus. And even with pregnancy, in some instances, we'll have more severe diseases than if a woman is not pregnant. And those are the risk factors that we know, making those individuals who are exposed to the virus have much more severe illness. Next slide. Next slide. Thank you. So next slide. So what we did here is to have questions that were actually questions that were sent in to us from your community, as well as from other communities that we've spoken to in the past, some of their questions as well. So I'd like to go through those questions and answer them the best we can. We're going to have time at the end of this presentation to answer even more questions or clarify things that might not be as clear. So the number one question is, who is more likely to get COVID? And I think we actually answer those questions, those individuals who have severe risk factors, but it's also the amount of exposure you have. So we know that those individuals who are close to individuals who have COVID, those who are in the healthcare field, those who are working in places where they have multiple individuals that they're surrounding themselves with, or even if you have a loved one who has COVID, you have increased risk of exposure. Next slide. So what can we do about that? So if you look on the one side, you'll see that there's some simple things we can do that all of our mothers probably have told us to do. Wash our hands, to cover our mouths when we're coughing, to make sure that when we blow our nose or wipe our face, that those tissues or towels we place in the trash right away. It's also, unfortunately, preventing from us handshaking, because we know that it spreads from person to person. To avoid large crowds, we know that that also increases your risk. To make sure that those areas that we use quite often, that we make sure those areas are clean. We know that also, like using mass transportation when in large crowds also can increase that risk. And one of the things is, how else can we protect ourselves? One is by staying home if we can, working from home, making sure that we wear coverings, especially wearing our mask. Even after we are vaccinated, they're recommending that we still wear our mask. And we'll talk a little bit of the reason why that occurs. The other tools is that for us to get tested for COVID. If you think you've been exposed to someone, or if you have symptoms, to get tested as soon as possible. And the final thing is to prevent getting COVID is by getting vaccinated. Next slide. So do vaccines work? Well, sometimes we forget that we all have been vaccinated when we're very young. So most of us have been vaccinated before we even went to school, because that was one part of the reasons why our priorities, our mothers would take us, or our parents or guardians would take us to our pediatricians, and we would get vaccinated for certain things such as the whooping cough, polio, are different types of vaccinations that we've already have had in our lives. But as we've come across over the years, we've seen that there has been other viruses over time, such as the flu. And you know that every year we have availability for the flu shot, which is also a vaccine. We also noticed that people wondered, what is this COVID vaccine? Is this really new? Well, this COVID vaccine also, the SARS, we've looked at other vaccines about 10 years ago when such other viruses such as Ebola came out. So it's not quite that new, the technology. But we know that vaccines helped from the past by, it helps boost our immune system, similar to produce antibodies that will help protect us from getting sick. They also are powerful unlike medicines, they, instead of curing disease, they prevent the disease. Next slide. So what are the benefits of getting a COVID-19 vaccine? I think this is the big question that a lot of individuals have been asking us, and even individuals who come to my office every day. So what, Dr. Ayers, what are these benefits for me getting this COVID-19 vaccine? And the second part we'll talk about is the safety of the vaccine too. And we'll talk about some numbers and try to share the information that we have already. So the COVID-19 vaccination will help you from preventing you from getting sick. That's the main reason. But I have to tell you, the real main reason for the vaccination is that we want to prevent people from dying. That we know that by getting the vaccine, they limit the amount of individuals who are hospitalized and who die. We know the vaccine is not 100%, and most of the time, even if someone does get sick after the vaccine, they're not as sick and don't need to be hospitalized or go on the respirator. And that's what we want to prevent. And you say, why is that prevention? Because we know when individuals get hospitalized or need to go on the respirator, they have an increased risk of death. And that's what we're trying to decrease, individuals from dying. We know that there is multiple recommendations that the vaccine alone cannot help us, that we need to protect ourselves and others by doing other things, such as we talked about before, by wearing masks, by washing our hands, by not being in large crowds. And however, we know that if we are vaccinated, that hopefully we can get back to our lives much faster than if we're not. Next slide. So many individuals, you've heard a lot in the media of what vaccines are available. That's one of the questions that came from the community. So we know that there's 3 vaccines that have received emergency user authorization from the FDA, and those are Pfizer, Moderna, and Janssen, and that's J&J vaccine. All 3 have been approved. They have been noted to be highly effective and safe, and they're highly effective against serious illnesses, like I told you about, hospitalizations and death. And that's what we are really trying to prevent, the hospitalizations and individuals dying. We know that the Pfizer and Moderna are similar in how they provide protection, and these require 2 doses, at least 3 to 4 weeks apart. And then the Johnson & Johnson vaccine is only 1 dose. And this vaccine is similar to the vaccines that we've used in the past, the technology. Next slide. So how do we know if the vaccine is safe? And this is a very, very good question, because I think this is where in the back of all of our minds is this safe? And whenever we have any, and I have to share with you, I'm along with me being a physician for the past 30 years, I'm also a researcher, and I'm also a public health advocate. I also do a lot with the School of Public Health. So I really, when we're doing these research, you have to understand that safety is the priority of how the FDA ranks if they feel comfortable in a medication or a treatment or a vaccine to be provided to the population in the United States. So initially, the small groups receive the vaccine and they see how those individuals respond. Then the vaccine is given to, say, different specific groups of people. They look at age, young people, older people? Are the vaccines different? Does it respond different? They actually look at races and see, does it impact different individuals, and look at making sure that the research has a vast number of individuals from different types of races and ethnicities. They also look at physical health. Does this impact individuals who have hypertension or are healthy or might have heart disease? Is there differences within this medication or vaccine? So that's the second area that researchers look at when they're looking at new vaccines and new medications. The third thing that happens then is, after the research is done for that 1 and 2, then they go and start now looking at how the vaccine or medication is given to thousands of individuals. Now, this is where they have large individuals who become part of the research and are research participants. And usually in these large research groups, they usually have one group who receives the vaccine and another group that doesn't. They're called blinded, so that the researcher doesn't know which group got the vaccine or not. And the patients don't know until the end of the study, or until if there's any kind of safety issues occur, then everyone's unblinded. They didn't do a comparison to see if the vaccine, the group that receives the vaccine, has a higher risk that's statistically significant than the group that does not. And that's how they determine if the vaccine is safe. Next slide. The reason why this is important is because the safety issue is a biggest concern, and I think it's one of the areas we don't actually give full disclosure about, or clear full disclosure. And sometimes it's confusing to the general population of actually, how do we really know this vaccine is safe? So the first agency that looks at it is our CDC, and they have this advisory committee on immunizations and practices. And what this advisory committee is open to the public when these group of experts discuss the safety of the vaccine. And it was, I had the pleasure of being a member of the observing group, and actually logged in on Zoom on one of the advisory committees on immunizations when Pfizer. They thoughtfully ask questions of the pharmaceutical company. They ask questions, they look at the data, they look at any complications, and they come up to a recommendation if they feel this vaccine is safe. Now, this is an advisory committee, so they don't actually approve it, but they then send their recommendations to the FDA. And once the FDA gets the recommendations from the advisory committee, they again look at all the data. They take what the advisory committee has stated on immunizations, and this happens on every vaccine, not just COVID, even the flu, different flu shots we've had in the past, other vaccines that we've used in the past. These are the steps that we have to go through in order for a vaccine to say that it's safe to be given for individuals of our population. Next slide. The other question that came up from the community is, how is it safe if it happens so fast? A lot of people were very, very skeptical because they said this vaccine was approved so fast. But what really individuals don't know is some of the information that was part of the production of the vaccine was information that was already known from other vaccines and had been approved and noted their safety in the past. So it wasn't that it was so fast. It was just that the technology was already there, but it was revved up for the other part 2 and part 3. So part 1, remember how we talked about 1, 2, and 3 of when we look at how we explore vaccines and how they're developed? Well, part 1 was already there, but 2 and 3 is what was I guess, revved up for the COVID-19 vaccine. So that helpful information helped us. We also know that in order for it to increase in speed, it was a lot of money was invested in the federal government, there was also other nonprofits and other companies that inputted money in order for and invested in this development of the COVID-19 vaccine because they felt it was such an important public health issue and crisis. And then the third part of reason why it went so fast was they were so amazed by the number of individuals who actually volunteered very speedily to be participants in the vaccine research protocols. And with all those things, that saved time so that the COVID-19 vaccine could be put on the market for it to be used in the population. Next slide. This just is an example of what the COVID-19 vaccine timeline was compared to the traditional timeline. Everything that does normally in a traditional timeline was still done, but you have to know that the initial development and research was already there. And we came at the time of COVID, they just started with the testing, and manufacturing and development was at the same time. So therefore, the approvals seemed much sooner than it was if you had a traditional timeline for vaccine development. Next slide. Now, this is a question that we get all the time, which is also important. Can I get COVID-19 from the COVID-19 vaccine? Because a lot of times when we say that we're actually producing antibodies for the virus by having the virus think that, having the body think that the virus is now being in your body, you think it's, do I get COVID from this? And the actual virus never goes into the vaccine. There either is a different type of virus, such as J&J, they use the adenovirus, which is not COVID-19, to mimic the body, to tell it parts of that virus needs to have antibodies. And with the Pfizer and the Moderna, they actually only are looking at a portion of the virus, which is not the whole virus of antibodies for just this one portion. And then the body produces antibodies against that portion of the virus. So you never actually get the virus. So to that answer, no, you are not going to get COVID-19 infection from the vaccine. Next slide. The other question, which is a very good question, and our colleagues have been looking at this as well, because this is a concern for all of us. Will COVID-19 change my DNA? Because we say that these vaccines are producing antibodies and are mimicking the COVID-19 virus. So no, they do not change or interact with our DNA in any way. It does not go, if you look on the slide and at the bottom, it shows a cell, and all of our cells have what we call a nucleus. And that's the purple part that you see in the diagram down below. And in that nucleus is where our DNA lives. When we do the vaccines, the vaccine does not come into contact or go into that nucleus. So our DNA is not in any way changed or is interacted with the vaccine. So the answer to this question is no, our DNA is not changed by the COVID-19 vaccine. Next slide. This is what is dear to my heart, because as an obstetrician, I have to ask in a lot of times regarding pregnancy. We have seen that in pregnancy, the COVID-19 virus has minimal complications normally. However, if you compare a pregnant woman to a non-pregnant woman, pregnant women with increased risk, such as obesity, women who are over the age of 30, women who have high blood pressure, women who have diabetes, have an increased risk of having complications with COVID-19 infections than women who are not pregnant. And we know those women have an increased risk of admitting to the ICU. They need more ventilation support, and they have increased risk of death. These group of women are very small, but those outcomes are very severe. We've also been noting as well, when we're looking at women who get infected with COVID-19 infections, that we're seeing more and more individuals have preterm birth. And we see that it's about 12, almost 13% of these women who have the infection will have preterm births. This increases the risk to the newborn because now these babies are being born earlier than they normally would be born. Next slide. I know this is a lot of information, and I want you all to make sure that when you're at home or in your Zoom, to write down your questions, because at the end, we're definitely going to be taking questions and explaining a little bit more areas that we might not have been as complete giving the information, but we want to give this generalized information first. The other question that came up is, do the COVID-19 vaccines have side effects? And the answer is yes. Serious side effects from the vaccine, however, is very rare. But we have that note that some individuals do have some minor side effects from the vaccine. However, not every person has these side effects. What has been reported is that some individuals after the vaccine have tiredness, headaches, pain at the injection site, probably is the most common. Muscle and joint pain. Some individuals have even reported chills, nausea and vomiting, and even fever after vaccination. Next slide. What has given us a lot of information and a lot of pause in the media is the risk of blood clots. And I think that we have to take a point in time of discussing this, because the blood clots have been seen with the J&J product. And however, I want you to understand where this information and what the numbers are in comparison. So when they look at with the vaccine, the AstraZeneca vaccine, they have 4 cases in a million that had blood clots. With birth control pills, we see about 500 to 1,000 cases in 1 million women per year that get blood clots from birth control pills. And this is a known fact. And that's the reason why we talk to women about that. We know that individuals who smoke, they have about 1,763 cases of individuals who smoke out of 1 million overall in the population of smokers will have blood clots as well. In COVID infection, we know, and this is those individuals who get COVID, we know that there's over 165,000 cases in 1 million cases of individuals with COVID who will have blood clots. So there's about 16.5% of all COVID patients will present with blood clots compared to the vaccine, where it's 0.004%. I don't want to belittle. I don't want to just, poo-poo the concern regarding the risk of blood clots, but we also have to look at benefit and risk. Whenever we do anything, nothing is 100%, but when we're looking at the pandemic and the way it is, we have to take all these things in consideration. And even though we're seeing this small number, the FDA and CDC has put a pause because we want to make sure that even the small cases, if there are increased risks for certain populations, that we can identify that and be able to tell the public and the population what is the real safety regarding the vaccine within each individual population, maybe by race. Most of the time we're seeing that it's more based on age, and also we've seen more women in certain studies than others. So they're usually between 18 and in their 40s, those women, and they're mostly less than age 50. But we still need to look at that data a little bit more, and that's why the pause occurred. Next slide. The other question that came up from the group is, I'm concerned because I've heard some people died after getting the vaccine. Well, we want to make sure that we know exactly what those true numbers are. And Dr. Brug is going to also share with you a lot more data concerning this. But I think all of us need to know what the real data is. I think knowledge is wisdom. And I think once people have knowledge, then they can make their own decisions. We are here to give you information so you can have an informed decision, not to say, oh, just get the vaccine. It's to have all the information there and for then you as an individual to say, is this the right decision for me with all the information? So in the United States, we know that the number of COVID cases are about 31.8 million, and the deaths have been over 568,000. And that's just too many individuals dying. We know in our state, we've had over almost 900,000 cases in our state. And right now, the state of New Jersey, we've had 22,614 individuals die. Those are individuals. And I get concerned when we put things in just numbers like that, because these are individuals, mothers, fathers, brothers, sisters, children, friends. They're just not numbers. And we need to be respectful of that as well. We know that in the US, the number of vaccines that have been administered is over 219,490,501 vaccines. From the deaths after vaccination, reported and fact-checked by Newsweek, we've had 966 deaths after the vaccinations. These deaths are all reported and they're investigated. And we know not all these deaths are associated with the vaccine. Some of them are from other issues as well. But we just need to know what the real numbers are. The others are the vaccines administered in New Jersey. We know that we've had over almost 4 million doses of one dose of the vaccine. And we have 2.5 million New Jerseyans that have been fully vaccinated. That's about 28.9% of New Jersey's total population has been vaccinated. Now, to get herd immunity, the target is to have 70% of our entire state to be vaccinated. Next slide.
I'm basically going to discuss some information in regards to mostly in New Jersey. As was stated by Dr. Ayers, we have over 800 cases of COVID in New Jersey with 22,000 deaths. And it's important to remember that even though we are being vaccinated, that you can still get COVID while we're doing this process. And people who have gotten COVID infections can get COVID again. The immunity that is actually does not last. So therefore, people that have gotten COVID need to be vaccinated once they come to that decision that they want to be vaccinated. The other thing is that while we're doing this, I cannot reinforce more how important it is to do all the other preventive measures. Next slide. And the burden and why we're having these community discussions, because as we note the numbers in New Jersey, there are disparities. The Black and Brown residents in New Jersey, we've been impacted the most, whether it is in regards to moderate and severe disease symptoms, to hospitalizations, and then to being admitted into the ICU, therefore increased risk of ventilation, and therefore increased risk of death. So age-adjusted, more brown and Black people have died, not only in New Jersey, but in many parts of the country itself. And while we're having this disparity about the the risk within the brown and Black communities, and now we have the vaccine, we see there's a disparity in regards to the vaccine. Next slide. So while the total amount of doses are 6.2, and we have 2.5 million people have been vaccinated, we can see that in the Black community, the numbers are small, but it says the Black community, only 6% of the residents in New Jersey have been vaccinated, while we are 13% of the population. While in the Hispanic community or Latinx community, they've been vaccinated about 10%, while they are close to 19% of the percentage of the resident population. So we haven't gotten this right. We actually have a disparity that is very, very slowly getting better. And the idea was that this was due to hesitancy. However, all data, and even with conversations, as we've been doing these community conversations throughout New Jersey, it isn't hesitancy that is the reason for this disparity, but it's access. So despite our history in regards to being tested on, experimented on, cells of ours being used, whether people point to the Tuskegee or the Lacks, Henrietta Lacks, that's not the reason why we're not being vaccinated. It's because of our lack of access to the vaccines. And that can be seen in that across the races and ethnicity, about 20 to 23% show vaccine hesitancy. The population that has the greatest vaccine hesitancy across the United States are actually white male, who have a hesitancy rate of close to 50%. Now, our access is mainly due to barriers to getting registered for the vaccine. So whether it is from the fact that we may live in places where there's no internet access, or we don't have high internet access, or we don't have a computer, or we don't have the time to be on the phone for X amount of time because we're working outside of the home, we cannot get a vaccine appointment. And if you do not get a vaccine appointment, you don't have the possibility of getting vaccinated. Next slide. The impact in New Jersey, but all over the United States, has been great, whether it's socially, physically, or what we consider medically, or mentally, or economically. And so there are services that are available in New Jersey. And I put these on for you to use. Please take them down. If you know anyone that needs help, whether it's from Family Healthline, which can give you all kinds of services in regards to food, housing, etc., please give them the 1-800 number. But in regards to mental health, and we know the increased suffering that has occurred with the COVID pandemic, and the increased rate of addiction that has been noted. There's all between the New Jersey Department of Health and Rutgers University, a line to help people to get to services in relationship to this. And that's the 833 number. Again, please take down the numbers and share it amongst your networks. Next slide, please. Thank you again for having me. And I now turn it over to Tracy Paris Benjamin.
Good evening, everyone. Thank you so much. Thank you, Dr. Brog. Hopefully everyone can hear me. Just give me a quick thumbs up. Been having connection issues. Thank you. I just want to thank the two physicians for the information presented. I've been on several community conversations and, some better than others. And I just think that you guys did a phenomenal job explaining this. I think one of the most important things is the messenger. And I've been saying that on a lot of my calls, who we are utilizing to share the information about this very important topic. While we know hesitancy is a real thing, we know that it's not the sole dictator of what's happening, as Dr. Brog said so eloquently. As a director of community health at Horizon, I briefly want to take the opportunity to showcase some of the things that we're doing to ensure that we are getting our members access to the vaccine. We recognize the huge disparity in itself, just the fact that we have to have a computer to get online, to go through this kind of maze. I can speak personally about my situation. I registered my whole family. Everyone else was called, and I was probably the last person to be called. And when I had to navigate to get the vaccine, it was quite a few phone calls and just, figuring out what the best way is to do this. And I can imagine for someone who's not familiar, I am in the healthcare system myself, to give up and to be frustrated and not want to pursue this. But in addition to reaching out to our members and making sure that they're aware of the resources that are available, scheduling appointments on their behalf, registering them at multiple sites, we are actually bringing the vaccines to the locations. And I'm proud to share that, we had a conversation earlier this afternoon with Pastor Chris, where we are focused on pop-up locations. So we're utilizing, clergy, which we think is really the backbone of several Black communities and Brown communities, but really using the churches as a trusted source to be able to partner with local pharmacies. So this is an opportunity where we are bringing the vaccines to the church on days that work best for them and making sure that we provide that access, whether it is assisting with transportation to get members to the actual location or providing them with additional resources, whether that's addressing food insecurity, needing, information on health insurance. This is not limiting. So we are also utilizing community health workers, and I just want to stress that because that's an important point. Community health workers are what we identify as natural born, caregivers. They are people who have this natural ability to do this work, and Horizon has really, led the charge in terms of hiring community health workers to serve as advocates, to really kind of be that peer-to-peer resource for members in the community, to have a dialogue, to come from similar backgrounds. And we think that this is really one of the ways to endorse the medical system. We know that there are structural biases and racism that exist in many of the healthcare systems. And there are blind spots that several caregivers, providers, may have themselves if they are not familiar with certain communities. So hiring community health workers is really one of our new strategies to address non-traditional care. So I know there were several questions in the chat. I don't want to take up too much time away from having the physicians speak to, members on the call today, specifically about COVID-19. But, this is just one of the many ways that we are thinking about how do we advance and ensure that people can, number one, make an informed decision through these community conversations, but lastly, give them the access that they need. So thank you very much for that, Dr. Brog. I'm not sure who the next presenter is or if I should pass it back over to Pastor Chris.
Yes, it's next slide is questions. So
Awesome.
Pastor Chris, it's all yours.
Awesome. Well, thank you, ladies, so much for your incredible wealth of information. We do have some questions. I will say that many of the questions that have come in, you guys were so thorough that they were answered as we have navigated this time together tonight. But I will read these questions to you and give you an opportunity to answer them directly. One question was, and I believe you answered this already, but can you explain mRNA or altering DNA as a part of receiving the vaccine? Any one of the?
So mRNA is a different, that's part of the Pfizer. It is actually mRNA of, it's a part of the part of the COVID the COVID virus. It's not the actual full virus. And that mRNA is used to transport within a protein that component, and your body produces antibodies against that. That does not go into the nucleus of the cells like we showed you, that purple spot. So it does not infect the DNA. This technology, though, is the newer technology we were talking about that we had seen, and they used it for Ebola. So we have some data about that. So it's not that we don't know how it responds. It was even given to pregnant women, that Ebola virus. So we have limited data. It's just that it wasn't a lot, but we have data regarding how that impacted. And that's the newer technology that this virus, this COVID vaccine is being used. But it does not go in, it doesn't go into the nucleus, so it does not impact the DNA.
Thank you so much. Second question that we had was, should we encourage our 18-year-old children or teenage young adults to be vaccinated?
Yes. 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 Yes.
Yes.
Because they tend to be the asymptomatic carriers. And then a lot of us live in multi-generational households. And so this asymptomatic carrier now comes into the home and infects the mom, the dad, the grandmother, the grandfather. And that's how things happen. And I can tell you, I've seen that happen in my own family.
In mine
the
too.
young adults
Mine
came in,
Mhm.
and now one aunt is dead, 2 are in the hospital. So 12 out of the 18 are infected, and it's it's something that is worrisome. And so please encourage your 18-year-olds, even 16-year-olds, if it's a Pfizer vaccine, to get vaccinated.
Yeah, Dr. Brog, I was just going to add that my daughter, who is 16, recently received the vaccine. And again, symptoms can be very different for everyone, but she was extremely resilient, I guess, and had no symptoms whatsoever. It was as if nothing happened, while my husband was like, laid out for a day. And, thank God he's fine. But I think, for the most part, I would just say several schools are requiring it. I know that Rutgers is requiring that for college students going back to school. So if you do have someone that's 18 and older, I would definitely encourage it. And like you said, if they're 16 and, you're thinking about it, I would really enforce.
Very good. Thank you so much. There's about 5 more questions. One is it okay to give the vaccine to a child with PG6 deficiency? Anyone want to speak to that?
Well, I think you should speak in general to the pediatrician, but remember, the vaccine is only approved, and only the Pfizer is approved for 16 years old and above. So, children, none of the vaccines for under the age of 16 is it approved for.
And it's not. And they're just doing the studies, everyone,
Correct.
for the children. They just started giving it, I think, about a couple of days ago, Dr. Brug, to children 2 and above, to see how those individuals, even younger children, were going to respond to it. But those studies are very small. We don't have the information out now. Hopefully, we'll have more and more by September. But even with that, it has not been approved for children under the age of 16 as of yet.
Thank you. Question, is it true that the vaccine only lasts 6 months? And or how often will we need to get the vaccine? Will it be yearly like the flu vaccine?
I think we don't have that answer yet. There is no answer for how often we're going to have to take it. I think my suspicion, I think most people's suspicion is it's something, the virus is here to stay. And the only way we can fight it is through this vaccine. And so with the studies, we're going to be able to find out how long this immunity is and if we need a booster. But it is likely we are going to need a booster, at least based on the way vaccines work in general. So I don't think it's like the other vaccines that you get in childhood and you're immune forever. I think it is more like the flu than not, because of the type of vaccine, because the type of virus that it is.
Awesome, thank you. One more, I believe. How does the vaccine affect one who has already had the virus? And I guess subsequently, is it important for someone who has had the virus and recovered to get the vaccine?
She answered that question in the presentation.
Yeah, I know. I just wanted to give the doctors an opportunity to respond directly.
Yeah, so I would say again, yes, it's important that someone who's had the COVID-19 infection to get vaccinated again, because that's something that we discussed. Your immunity does not last. And we've seen that people have gotten the virus, the infection twice, and one case of 3 times. So it's important that you do get vaccinated again.
Is there anything that folks can do to reduce the side effects of the vaccine when they get it? So folks are saying, I'm nervous about the side effects. So is there anything they can do to kind of reduce or mitigate some of the side effects of the vaccine?
You're on mute, Aisha. Oh, there.
So what I would say is, I think everyone sort of prepares for all the side effects, the potential side effects for the vaccine. And I've seen even my own colleagues sort of prepare for it. So I think if you're going to schedule your vaccine, prepare to get it on a Friday. You know you're going to be off on the weekend in case you do have the fatigue and you may not be able to perform at work. If you feel like you have a low-grade fever, take Tylenol. Take something for the headache. Take something, Tylenol will work for the headache and also for the fever. And I think I think preparation, if you know what to expect, then we can't be surprised when it happens. And the point is, some of my friends joke, they were like, oh, I had a terrible, side effects, or I was really tired. It must be really working. Like, I know my immune system took this, and so that's not really how that works. But basically, it's just a short-term headaches and fevers, and it's going to be better, I think, and being fatigued. So prepare for it. Make sure you don't have to be somewhere or do anything important within the 48 hours that you get the vaccine. And you'll be surprised that you may not have any symptoms, because most people don't. And so the only people who are sort of reporting their side effects are the ones who had them, but they're not the majority. You can have side effects from Tylenol. You can have side effects from over-the-counter medications that we take all the time. All of them say there's a risk of death with every medication we take. And so, and vaccines also, but it's extremely rare. And if you know that they exist, knowledge is power. If you know that this could happen, understand it, live through it, and be glad that you're immunized and that you can sort of live to talk about it, So I think that it's fine to have side effects. Side effects happens with many drugs, and just get through it. And it's better than the actual infection.
Awesome. Listen, we have 2 more that came in just now. I want to use those as our last 2 questions. And one is it really safe to travel after being vaccinated? And then question number 2 is, what would you say to convince an older person who has been influenced by conspiracy theories to get the vaccine? How would you encourage them to do that? So is it safe to travel? And how can we encourage some of our family and friends who are on the fringes of getting vaccinated?
So in regards to traveling, I think that once you're vaccinated, you have to remember, you still need to wear a mask. You still need to wash surfaces, in my opinion, okay? You need, so if I'm on a plane, I would still wipe down the seat and wipe down the the tray and everything, and try to be as distant as you can, depending on where you're sitting, of course, or where you're lounging before you get on your flight. Same thing if you're driving and going into a hotel or you're going somewhere, you just need to remember to try to do the same safety measures despite being vaccinated.
Thank you. And as far as convincing some folks who are influenced by conspiracy theories and such.
The convincing, I think knowledge is power. I think I would say is to give them the information as much as we know. Try to be aware of what their real concerns are and their fears and try to address them. I think this is the time for us not to force anyone to do anything that they don't feel comfortable with, because I think that can backfire on anyone. I think it's most important for us to give individuals the information, be clear about it, try not to do scare tactics. I think that's not good either. That's not a positive way of giving information. And I hope for having them to come to community forums like this, for them to, get the information and address their questions that they may have. And you have to be respectful, because there's been a lot of information and things have happened in our community. We can't ignore that. And we can't say it didn't happen. But I think this is a pandemic. Individuals of color, Black and brown, are dying at a much higher rate. And I think that's the part where I get the most concerned, that everyone just needs to have that information and then make their decision.
Well,
I would probably just, sorry, Pastor Chris. I was just saying, I think I definitely agree with 100% with everything related to what Dr. Ayers just shared. I think the other thing is really asking that individual about, things that they'd like to do, thinking about moving forward, whatever our new normal is, but being able to be back with loved ones. Maybe you won't have a desire to travel. Maybe there's something that you've always wanted to do that you are now thinking, I'll never be able to do it again. That to question those things, and then also let the science guide you. That would be one of my suggestions. Some people have said, well, I want to see my child get married, and we know that this is herd immunity is what's going to get us closer to that. So if this is an option, maybe that's one of the ways that you begin to deliberate on how you make your choice.
And I would like to also say that there are different community events that we're doing. We're doing these community conversations all over the place. So if you know someone that's in Northern or Central Jersey or a different part of South Jersey, they can actually go onto our New Jersey Black Women's Physicians Association website, and they can get the dates of when these conversations are happening. www.njbwpa.com. But I know Pastor Chris has all our contact information, but I think that's important. I think, and that's why I personally do it, because I want to be able to give the information to our community and then have them ask questions so that they come and they are comfortable with the decision that they are making for themselves and their families.
That's awesome. That's awesome. And you are correct. I do have the information. And so to our Delaware Valley Church family, please know that we'll be making this information available, as well as our entire gathering tonight has been recorded. And so we will make it available on our social media outlets. So if you got some information or you missed some, you'll have an opportunity to go back and to revisit it. We certainly want to celebrate our panelists and thank them for their wealth of information that they have shared with us on our live stream. God bless you guys. Have a wonderful, wonderful evening.